It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com. Part of the team from the Indiana Regional Medical Center Center for Spine and Pain Management with us this morning. Our conversation is brought to you by Marcus & Mack, voted best personal injury law firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. Dr. Jonathan Scholl is the medical director there, and is board-certified physician's assistant Sydney Harteis with us as well. Good morning to both of you.
Good morning.
It's good to have you both with us. I was teasing about the Pirates injury report, but we're talking about chronic pain, and September is Chronic Pain Awareness Month. And, well, they've got some things there that you guys could probably help them with. Henry Davis, the catcher, he's got a bad hand that he's been trying to fix. It might be a broken thumb. They're just not sure, but he's got pain in the thumb. O'Neill Cruz, they're fitting him with an orthotic after he fractured his ankle, and they're trying to get him back to speed. Andrew McCutcheon partially tore his Achilles. You guys, that's your arena, isn't it?
That's true.
Jeez.
And pain can happen at any age. Those professional athletes, have injuries that have pain, but pain comes from any person in society, and we're here to really be able to treat them and bring that back, that quality of life.
Yeah, absolutely. And the Center for Spine and Pain Management is all about that. Sydney, what is chronic pain? How do you define that?
So chronic pain is defined as pain that lasts longer than 3 months. And when it's lasting that long, it really affects a patient's quality of life, not only physically but mentally. So whenever we see patients, we really try to address kind of their holistic care mentally and physically.
And it doesn't have to have occurred from a specific injury that, I know when that happened and therefore I've got this pain. You can get it just going to bed at night.
Yeah, exactly. I mean, we see all kinds of pain ranging from acute but mostly chronic, and all age ranges. But yeah, the chronic pain lasting longer than 3 months is typically what we see, and the vast majority of it is low back pain. But we see really any pain issue. Joint pain, neck pain, headaches, neuropathy, nerve pain. So, any pain issue you have, you can see us. And if we can treat you, we will. If not, we'll kind of figure out where to send you to get help you need.
Yeah. So, Jonathan, O'Neill Cruz, the Pirates shortstop, fractured the ankle in April. Came back and started his running program, felt pain in his foot. And it was a fractured ankle. It wasn't a foot injury, but as Todd Tomczyk, the Pirates director of sports medicine, said at the time, that's a domino effect. Anytime there's something down there with the foot, one thing off in the foot causes something else to be off. And people do. They suffer those sorts of foot injuries and chronic pain in their feet, and they really can't pinpoint why. They just know it hurts.
Absolutely, yeah. And a lot of times we see that with knee pain. So a patient may have knee pain or a knee replacement. It may change the way they walk, change the way their weight moves side to side, and oftentimes they'll develop back pain. So addressing the person as a whole and understanding, all the different components of what's causing their symptoms is really something we're passionate about at the Center for Spine and Pain Management. Being able to identify what we call the etiology or the source of the pain is very important. Sometimes a patient may present with back pain, but it could be SI pain or hip pain. That's really the source of the symptoms. So we do a full evaluation at the Center for Spine and Pain Management through physical exams and diagnostic testing to really identify what is causing your symptoms. Once we can identify that, then we develop a multimodal treatment plan to address that source of the pain on multiple different levels, whether that's interventional procedures such as injections or nerve blocks or even nerve ablations. We do nerve ablations in the neck, in the lower back, and in the knees. That can take away someone's pain by terminating the sensory nerves at those locations. So it's a lot of advanced techniques that we can utilize to provide people help.
We had another story this morning in our preparations about pain and chronic pain, and it involves something called mommy's wrist. Have you aware of that term?
I don't think
Sydney,
so.
do you know mommy's wrist?
I don't.
Mommy's wrist is a wrist condition having to do with tendon pain in your wrist from carrying a baby.
Okay.
And crooking your wrist like that. Mm-hmm. They related it to, they're calling it mommy's wrist with people with their laptop computers, carrying their laptops underneath with one hand and walking through the room. and your wrist is developing that same sort of tendon pain.
Sure.
And that has a specific cause, but still that wrist pain is something that is it's very common.
Absolutely. Yeah. And people think that, pain is part of the normal aging process, but it's really not. Oftentimes we can identify a source of pain, provide appropriate treatments to that patient, and see improvements in the pain that they're experiencing, and get them back to doing the things that they want to do and having the quality of life that they deserve.
Sydney, when somebody comes in to the Center for Spine and Pain Management, and they present themselves, say they've got a hip pain. We had another story about that today, about somebody carrying their backpack or their computer bag on their shoulder, and it causes a misbalance, and they've got hip pain. When somebody comes in, they say, my hip's hurting.
Yeah.
What's the process that you go through in that evaluation? I'm sure it's pretty involved.
Yeah, so it's pretty much what Dr. Scholl went back to, identifying the source. So in order to identify the source, we have to talk to the patient and ask them questions about their symptoms. So we get a good history on when this started, what makes it worse, what makes it better. We ask a ton of questions, and then we do a good physical exam. So we kind of have an idea of what could be causing the pain. And then to assist that diagnosis, we can order imaging studies or, different tests that can confirm what we believe the issue is. So then we can really figure out how to treat that issue.
Are there family history issues that could crop up with this as well? My family always has neck pain.
Yeah, we hear that all the time. Yeah, I mean, certainly genetics can play a role, a lot of these issues. But, a lot of it is lifestyle, too. So we place a really strong emphasis on healthy lifestyle, weight loss, healthy eating, tobacco cessation, healthy sleep. So we really try to address pain from multiple angles.
Yeah, Dr. Scholl, when folks do have that chronic pain and they say, but I didn't do anything to cause this, that could just be the problem. They haven't been doing anything.
That's right. It's a fine line. We don't want patients to flare up their symptoms, but there should be some stretches, exercise that you can do every day to increase your core strength and your back muscles to provide stability to the spine. Another common diagnosis that we see is that sciatica. When patients have that pain down the backside of the leg, usually that's an irritation of a nerve root in the spine from either a prior surgery or arthritis or spinal stenosis. Scoliosis is another common diagnosis that we see in the community. All these things can be treated and effectively cared for at the Center for Spine and Pain Management.
A lot of that pain, doesn't matter where it is in your body, can emanate from something going on with the spine, right?
Absolutely, yeah. Our spine carries all of our nerves that run down to our extremities. So if you have numbness or tingling that's running down to your arm all the way to your hand or down your leg to your foot, this is most likely a sign of a nerve root irritation. If left untreated, it could get worse and lead to more serious symptoms such as lack of movement or even increased pain in the extremity. So being able to stay ahead of your pain is important. Sometimes it's harder to catch up to the pain than it is to stay ahead of it.
Yeah, the inability to bend over and pick up something, and incorrectly picking things up for all of your life can lead to something like that as well. When we're talking about spine pain or pain that is emanating or originating in the spine, there's not a one fix for them all, is there? There are many causes, so there could be many remedies.
Absolutely, yes. And so it's really, and what we're really passionate about is really identifying what's causing the symptoms. Because if we don't have a good understanding, or your provider doesn't have a good understanding of what's causing the symptoms, then the treatment strategies will not be much less effective. So like Sydney said, doing that physical exam, really taking a passion and identifying what is causing the pain and be able to communicate that to the patients and have them understand it through our spine models that we have in our office. We explain in very detail what is causing the symptoms and why they're feeling what they're feeling. And then getting a treatment strategy that's going to be effective to get them back to doing the things that they like to do. Like Sydney mentioned, it affects your mind and your outlook, but also it affects your relationships, being able to play with the grandkids, being able to interact with friends, go out to eat, go for a walk in the summertime. These are things that, everyone should have privilege to do. And our goal was to get patients back to that functionality to enjoy their life.
Yeah, and Sydney, if you design a plan for somebody and it doesn't work and they're still experiencing the pain, doesn't mean give up, because there are other options available.
Right. Yeah, we reevaluate those kinds of patients all the time, where we treat them and they come back and see us and they don't necessarily feel better. But more often than not, they just have another issue going on. So we bring them back in, we reevaluate, and we just kind of go through the gamut and try to figure out, what's causing the pain. And very often it's a separate issue. So then we treat that issue. And yeah, it's just a constant cycle.
Once that pain is alleviated and they say, oh, I'm back to normal now, is there a maintenance that they must do? Or is that a typical thing that, okay, this caused it in the first place, and therefore we've addressed that, but here's what you need to do down the road?
Yeah, and I mean, there's that focus on healthy lifestyle. So, and prevention is a big thing that we talk about and work towards. So they prevent those further injuries down the road. But if patients feel better, they kind of follow up with us as needed if there's an issue in the future, but with a focus on living healthy and avoiding further injuries in the future.
I know, Dr. Scholl, that there are times, and probably quite often, when you hear the "I've tried everything" come out of somebody's mouth when they come in there. And it is a little bit of detective work on your part, isn't it, to find out?
Yes, absolutely. And, that becomes frustrating for patients, and rightfully so. But being able to have a, pain specialist in our team here, we're really passionate about the quality of the team that we have, and also the patient experience. We have staff on our team with 20 years of pain experience in the pain field, and having nurses, LPNs, medical assistants, a coordinator of the service line, all with great experience. We are really passionate about the care that we can provide to the community and to patients in pain.
So somebody is suffering right now, and they haven't done anything about it. Do they have to go to their primary care physician first, or should they, or can they come right to you?
They can come right to us. They certainly don't need a referral. If they have one, that's fine. But you don't need a referral to see us. So anybody can call our office. I have the number here. It is 724-357-8135. And you can call and get an appointment with us without a referral. Now, it's helpful if you have records, if you've seen a pain specialist in the past or had imaging done before, to send to us. It's kind of just saves some time, but you don't need to have those things or a referral to see us.
It's all part of that investigation,
That's
isn't
right.
it? Try to figure this thing out. So you have to be a little bit of a Sherlock Holmes to find out some things. But once you do, then maybe that sort of directs you into how it is that you should approach treating this patient versus that patient over there.
Absolutely, yes. And, the patient that, has tried everything, there are advanced techniques that we utilize at the Center for Spine and Pain Management. Specifically, spinal cord stimulation is another advanced technique where we would implant a stimulator into the spine, and it can block the pain signals as they travel up your spinal cord. So someone who has tried everything still has that back pain or leg pains, or even diabetic peripheral neuropathy is another one that's commonly treated with spinal cord stimulation. These are things that may benefit from advanced approaches and techniques, and everything that we recommend to our patients are always evidence-based, meaning that there are studies that support the treatment strategies that we promote at IRMC, as it is an academic facility. And so we're passionate to provide quality service to our community.
Well, I certainly believe that after the Steelers game next week, there will be more injuries that we could talk about. We've certainly had some with the Pirates here this morning, so the Steelers will have their share. And, Mom and Dad and everybody else walking about in our neighborhoods, they've got their chronic pain issues as well. Dr. Jonathan Scholl, Sydney Harteis, thanks so much for visiting with us today. We appreciate it.
Thanks for having us.
Thank you.
It's kind of weird to say it, but happy Spine and Pain Management Week or month, whatever September happens to be.
And 5-year work anniversary for Dr. Scholl.
Doctor, you've been here 5 years?
Oh, time flies. That's true.
How cool is that?
Very cool.
I'd have had a cake if I had known. Thanks so much.
Thank you.
It is the voice of Indiana County. It's WCCS 101.1 FM, AM 11.